Your Excellencies, the First Ladies, Honorable Ministers holding the different portfolios, I want to give a special appreciation to the First Lady, Her Excellency, the co-chair, the First Lady of Zambia, Mama Esther Lungo. I'm Dr. Joyce Moriku Kaducu, the Minister of State for Primary Health Care, a medical doctor by training, a pediatrician, and I hold a PhD in health. Allow me to, first of all, appreciate the Merck Foundation and all the team for inviting us for this very important meeting of the 8th edition. And I want to bring a warm greeting from the people of Uganda. And this is my first time to attend this meeting. It was previously my colleague who was attending. And I want in a special way also to really appreciate this time that the meeting has come when we have the COVID pandemic. Allow me in a special way to appreciate and thank our president, the president of Uganda, His Excellency Yoweri Kaguta Museveni, for he championed and he gave a firm leadership to the people of Uganda that have seen a significant reduction in the COVID infection during the phase 1. However, we still have the phase 2, which is actually coming up right this time. And I want to make this clear that the people of Uganda so far, we've got a cumulative infection of 41,737. However, unfortunately, we lost 342 people. But the good news that we have is that last month, we received a COVID vaccine from the COVAX facility. We are very grateful as the people of Uganda, and the country launched that vaccine on the 10th of March. And as of today, our people have been responding to it slowly though, but the first frontline workers and other people at risk have been the first people to receive the vaccine. Allow me, members, to say that COVID-19 has come with a positive and negative effect. And indeed it is true. The significant effect has been seen on the future of our young girls. The teenage pregnancy rate has gone up all over. For us, the people of Uganda, previously the prevalence was 25%, but this has gone up to 30% and much higher in some parts of the country. The pandemic has affected health service delivery, most especially maternal health service care delivery. Antenatal care was affected because during this pandemic, the first antenatal care for us, mothers have been going, it went up to 95%, but the fourth antenatal care has significantly reduced due to challenges of transport, challenges the mothers meet along the way. The health service also during COVID has been significantly affected, most especially people with chronic infection, those with TB, HIV, diabetics, hypertension, and other chronic liver disease, cancer, and what have you. And important to say is that domestic violence has significantly gone up, and the economic impact has really negatively affected most especially women. What is the way forward as a team, as member states, as we have come together for this very important meeting? One of the way forward, as we discuss today, is to look at regional collaboration and coordination. How do we collaborate as a region and coordinate some of what we do together? Number 2, we need to share best practices, how best the pandemic has been managed in some parts of the country, and what are the negative effects that we can share together, bring on board, and we can take leads from one another. Number 3, we are still in the same continent. There are cross-border infection, cross-border movement, and this need to be discussed and harmonized. How do we help our border post points in order to prevent the spread of this further infection? And lastly, we can come together and share best practices, most especially the issues pertaining the girls and the women. For example, here in Uganda, the schools have been opened, but the manner at which we open these schools is in a staggering manner, such that when you have the candidate class are studying, the others remain at home. As the candidate class get going back home, other classes come back. But this has been a challenge as we see the second wave of infection coming up. Right now in Uganda, most of the clusters of infections are affecting the school-going children. It is affecting those in secondary school, the nurse training institutions, health training institutions by the virtue of their being closer to the hospitals. So these are some of the experiences we can share and how best we can manage and help each member state. And finally, for us as a country, as we manage this pandemic, we've been trying as much as possible to strengthen and build a resilient health care system and to put our health worker on the forefront so that the infection can we can minimize the infection among the healthcare workers who are the strong building block of the healthcare system. I thank you.